Hi everyone, great to see you. I have a really interesting resource I wanted to share with you, and that is the Return to Run Guidelines for an Ankle Sprain. Now, this is an evidence-based guide that's going to help you take those runners that had an ankle sprain and get them all the way back to running. It's everything you need to know. So first, I want to go over a little bit about prevalence and the risk factors of ankle sprains. And up to 40% of all sports-related injuries are actually ankle sprains. It's quite a lot. And those ankle sprains are most frequently the anterior talofibular ligament, the most commonly sprained ligament in the body. And we know that ligamentous laxity and joint instability are leading risk factors to this. And the reason for that is because the looser that ligament is, the more unstable that joint is, we just have more motion. That more motion, especially while running, has an increased risk that all of a sudden the motion goes too far. And then all of a sudden that runner sustains an ankle sprain. So we know those are leading risk factors, and we'll see later on how those risk factors mean certain aspects of treatment or our plan of care have to incorporate being able to strengthen them and be able to help combat against those things. We also know that an inverted foot position at initial contact or at ground contact is a risk to injury. That is the picture we can see here. That is a lot of inversion. Obviously, that is sustaining an ankle sprain. And then we also know the Ottawa ankle rules help to rule out a fracture and assess the need for an x-ray as well. Those ankle sprains are graded 1 through 3, with 3 being the worst. Now let's get into some of the really important content when it comes to a patient that's come to see you. We've diagnosed an ankle sprain. Now they're getting towards the end of their physical therapy treatment or rehabilitation treatment. And now we're talking about what we need to do to get them back to running. And that's where I want to bring up the topic of strength training. And many of us don't know that strength training is really needed for runners. Runners who aren't doing strength training have a large risk for injury. And especially those runners who are coming back from an ankle sprain or an injury, if they're not doing strength training, especially as they start to reintroduce running, that is a big risk for them. So one of the things I want to stress is that strength training is really beyond those traditional PT exercises. And I don't mean that's what all PTs are doing. There's a lot of great PTs that are doing some great strength training for their runners. But I just wanted to call out this because it's so important to give those runners a good strength training program that they can implement and use for their patients, because we want to make sure that we're giving patients the tools to be able to get a lot of strength to be able to accommodate all those forces while they're running. So when we do strength training, and this is well researched, we can see that that significantly reduces the amount of risk for injury for all those ankle sprains. A couple of exercises that are really important and are really good to do are in this list, and I'll show you them. But I want to call out that both balance and resistance training in multiple directions is really helpful. Now, I wish I could put all of the different exercises on here, and if that's something folks are interested in, please let me know, message me, let me know. I can give you more exercises or examples of exercises. But I put on 3 here that are really important, and you can progress each of these with intensity. You can increase the sets, you can increase the reps, you can increase the weight, and obviously make it harder. So 3 that you can do are single leg heel raises. And I don't just mean single leg heel raises, maybe 5 or 10 or 15. I'm talking about maybe 30 in a row, 35 in a row, 40 in a row, upwards and upwards and upwards. So I like this because it's going to strengthen the posterior chain. It's also going to create a lot of stability in the ankle itself. And it is such a needed motion for running that plantar flexion strength is important to propel yourself forward while you're running. Another really good exercise I like is the single leg jump impact loading. And that's going to be where you squat on one leg. Now, again, that squat isn't just a floppy, not good form squat. This is a squat that is good single leg squat. You're going to come up and jump nice and high. Some people would say go as high as you can. However, on the landing, we're coming back into a really good single leg squat as well. This is where we incorporate some of that balance. This is where we incorporate some of those really helpful strength and all those muscles around the ankle to be able to support ourselves when we're running. This is also really important because when you're squatting and jumping on your one leg, that's kind of like mimicking running. You are squatting and moving on that one leg to get more stability and more strength. Now, again, you can add weight, you can add sets, you can add reps. And I said some people go as high as they can when they jump, because if you can go as high as possible and then land with good form, then I want you to do it. However, if you're not able to land with good form, I don't want you to do that. Another good exercise you can do is the lateral single leg jump. So side to side to side to side, going to strengthen the lateral aspect of the ankle as well. And this is a really good tool. Again, multi-directional is really important. We don't run just in one direction, and our feet don't land on the ground in just one direction. So making sure you have the strength on the lateral and medial aspect of the ankle are going to be so important in terms of ankle stability. So these are 3 really good exercises to use, and they are easily progressed to be harder and harder. This first page of our guide here is a nice tool you can use when you are either doing community presentations or talking to patients. Take this first page of the guide, put your business card on there, or even better, email this first page of the guide to the patient, and then they have your email. They can reach out to you for questions. Start to build an email list, especially if you want to grow your business and you want to market to runners. Make sure that they know that you have the information that's going to help them get back to 100% and get back to running. One really good way to do that is to give them a little bit of the information, like the prevalence and risk factors, and then give them a couple tools they can use for strength training. This is something I've used in the past, and it can be really effective. So try it out, especially if you want to market and build your business with runners. Now, the rest of the pages for this guide may not be as consumer focused or not as much focused on layman's terms or something that patients can be able to use or implement, but it's really good information for us as clinicians to be able to implement with patients, especially as they're returning from an ankle sprain. So we are getting that patient some really good strength training. They're coming to the end of their PT. How do we assess whether they're ready to return to running? Well, it comes down to 2 important things: functional testing and limb symmetry index. So let me first talk about functional testing. Functional testing is testing that we can do with patients that's going to mimic everyday activities, or it's going to mimic things that they're going to find in everyday life. Now, I'm going to go through a couple examples here, but the idea is that with this functional testing, we're taking them through movements and composite movements that's going to help get a good idea of what their ability level is, what their strength is, and how they can perform those tasks. That is the best thing we have to be able to relate whether they're going to be able to successfully run and go do all those things they want to do. So functional testing, which we'll talk about, is really important to use, but it's also really important to have a tool that we can be able to measure that. And that is the limb symmetry index. And if you're not familiar with what the limb symmetry index is, you are going to take the affected limb value, you're going to divide the unaffected limb value, and multiply by 100. Now, to return to running, you want that LSI score to be over 90%. And you can calculate the LSI with any functional test, with a figure 8 hop, crossover hop, Y balance, and many others. So use functional testing, and with the scores of your functional testing, use the limb symmetry index to be able to determine if that runner can run again, and that has a much better likelihood they don't get injured when they start that return to run program. Here's 3 that are really good for the ankle itself. So we have the figure 8 hop. The figure 8 hop is a really good way to assess ankle strength, not only because it's going to measure how fast you can go around these cones. So you start on the little start area down there on the bottom left. You're going to hop all the way around that cone, and then you're going to come back. Now, the calculation of the figure 8 hop is a little bit harder, and so there's a good reference we can do. We talk about this in our course, ready, set, run, crafting a successful return to run program. However, the important part is here we can still use our LSI to get that score and calculate whether it's at 90% or higher. So figure 8 hop, really good, not only balance, but it's also going to measure strength, and it's going to help us get a really good measure of whether a patient can return to running. Another really good functional test to use is the crossover hop. So the patient starts at the bottom left, they're going to hop over a line, back over the other side, back over the other side. We're going to measure distance here, and we're going to instruct them to jump as far as they can. And again, you're going to take that distance and you're going to calculate your LSI, the affected limb divided by the unaffected limb value times 100, and then we're going to determine if that is 90% of the other side. So again, we want to make sure those two limbs are going to be very close. We want just 10% difference at the most. Again, they should be pretty even. Asymmetries when you're running aren't good. And lastly, I want to go through the Y balance test. And many of you have done this one before and probably heard of a decent amount of these, but it's good to know which ones to use and how exactly to go about using them. The Y balance, one foot comes forward on that little Y, that red Y at the bottom, and then you're going to tap it outward and backwards back behind you. You're going to do this with both sides, and you're going to take the total distance. So you're going to take the total distance that your limb went anterior, lateral, and lateral posterior, or back behind you. And you're going to take that total value, divide it by 3, and then you can get your score, or the number to plug into your LSI, affected limb divided by unaffected limb times 100. So when we're assessing a patient to return to running, we want to make sure they have a really, really good set of tools. The functional testing is a great way to go. Make sure you're using the LSI to be able to determine if you're going to be able to get that patient to running again. Now let's talk about running guidelines. Again, we go over this in Ready, Set, Run, but I want to talk about it here too. This was a much bigger picture, but I just took a couple phases out for you so you could see them. Now, for runners and for ankle sprains, it's always hard to determine how we can start someone running or how much to have someone running. It's so many variables of intensity, frequency. We have a lot of variables of if they're doing corrective exercises at the same time, how much they have to walk to work. There's tons of dynamics. But let's take out some of those dynamics and let's just say we want someone to start running, especially going through these phases, if they're not having pain in everyday life, soreness, and also we're instructing them to do a warm-up before they start these phases. And then lastly, with these phases, we are also saying that they're going to take several days between the phases. I suggest 2 for these first 4 stages or phases, and I actually only change that they can do it every other day when they get to phase 6, which is not pictured here. So again, the running guidelines can be really important when it's walking you through the different phases. And I notice that this is really effective for patients because they know exactly how much running they're supposed to do on each day. So for phase 1, you do 5 sets of 2 minutes of running and 1 minute of walking. And then in phase 2, we do 5 sets of 3 minutes of running, 1 minute of walking. And you can go through these different phases here, and I'll let you decide and take a look at it to be able to determine how you would progress your patient through this, because it's all on your clinical reasoning. But I just wanted to give you an example of phases that you can use to be able to implement runners into that return to running program. I like to get runners to run 30 minutes continuously before they are done, and then that's kind of the point we will cut things off. Obviously, over 30 minutes might be a goal for some runners, and some runners may be having pain over that 30 minutes, but that 30 minutes is kind of a good threshold to use. Again, the running guidelines, there's a nice handout. If you'd like the handout, please let me know. I'm happy to send it to you. And this is a really, really important thing to do for runners to make sure they know exactly how much running they're doing at each moment. So if we've assessed the runner to be able to determine that they can start running again, we've given them some running guidelines of how much to run. Now they're running, and we might be seeing some gait deviations that they're presenting with. So this is where you can do a running gait analysis. You can be able to determine, hey, this patient is running the specific way. What gait deviations might be of concern for re-injury with a patient with a ankle sprain or recovering from an ankle sprain? And the big thing here is that ankle sprains aren't really the issue. It's actually that most of these patients have gotten out of the acute phase where they're actually have an inflamed ligament or joint or swelling, and they're now in a phase where they just have ankle instability. I wrote chronic ankle instability here because that's what a lot of the research is talking about, and that's what people with chronic ankle sprains that results in chronic ankle instability. But here's some of the presentations that we see. We certainly see that on the gait cycle, as we can see pictured here, that they have an increased plantar flexion at initial contact. So they're kind of landing on the ground a little more flat-footed, potentially maybe a little more midfoot, maybe even forefoot. And that's helping not use as many of those ankle stabilizers, especially those everter muscles, and especially some of those muscles that are going to really slow and do the loading response when you're landing on the ground. We also see these runners having an increased inversion at heel strike. So when they're landing on the ground, they are inverting quite a lot because that is the position that's going to be a little stronger for them. The problem is that that inversion can cause another ankle sprain. We want to be very careful with how much inversion this patient can do, this runner can do. We also see a limited amount of eversion during mid-stance, and this one's important. There's decreased plantar flexion with the toe off. We do not notice these patients are pushing as far or pushing as hard off their toes. And some of that is because they have a decreased step length and they're maybe having an increased cadence. They are not elongating that stride because their ankle, their joint just isn't strong enough. Those muscles aren't strong enough. So these are the gait deviations we need to be mindful for. How can we help them avoid these gait deviations, these wrong gait patterns that are going to cause more pain? Well, some of it comes down to gait retraining. Now, I want to make a special note here that gait retraining isn't the only way that runners can improve and get better with their running. A lot of it is the strength training we talked about before, and a lot of it's making sure they're running at the right time. Footwear is an aspect of that too. But I want to go over a couple gait retraining tools here. And both verbal and visual cues are really effective in gait retraining. That's an important thing to note. Now, when we go through and we talk about these gait retraining techniques, some important things are to understanding what the aim is here. So gait retraining cues are aimed to increase the stride length, and specifically we want to increase that mid-terminal stance. Also, limit the forefoot external rotation. So make sure they're not turning their foot out. Some of these folks have had limited dorsiflexion, or they're having a little more inflammation when they're running, or just don't have the strength. That can cause a little bit of that external rotation. And they're having a decrease in cadence here because we want to actually make sure they're elongating that stride out and making sure they're taking really long steps when they run to make sure they're using all those muscles. And lastly, we want to limit the foot inversion at initial contact. Some of the ways we can do this is using a metronome to elongate that stride. We can tell them to push or finish their strides behind them. We can tell them to keep their feet apart while they run, or to make sure their feet land on either side of a thin white line when they're running. And then lastly, we can give them the cue to make sure they're feeling the ball of their foot when they run, to make sure they're putting pressure on the balls of their feet when they run. Last thing I want to go over is some footwear. And footwear can be quite important when we're talking about ankle sprains. Here's the things we want to be careful of. The shoes and the attributes of these shoes should encourage the runner to do several things. We want to increase the heel strike at initial contact. We want to limit that inversion. And then we also want to limit excessive dorsiflexion, especially during terminal stance. We want to limit the impact from the ground reaction forces. And then we also want to reduce the stress and load on the ankle. So here's how we do it. So in this case, to increase the heel strike at initial contact, we're going to want to make sure we're giving them some heel strikes, that they're landing on their heel, and we don't want that to exceed the pre-injury levels. One of the important parts is going to be that we're recommending patients to get moderate to high heel drop shoes. That's going to encourage that earlier heel strike. That's going to make sure they're landing on the ground with their heel. Also, it's going to be the limited inversion, and we're going to do that by being able to give them a neutral arch. We don't want to give these patients a really high arch, which is going to cause them to push out into inversion. Also, when we're talking about the limits of excessive dorsiflexion at terminal stance, this is important when we talk about the heel drop as well. I already mentioned moderate to high heel drop shoes are recommended. We don't want a zero drop shoe because a zero drop shoe is going to force them into that excessive dorsiflexion. Also, we want to limit the impact from the ground reaction forces, as we mentioned before. Avoid those max cushion shoes. If you haven't heard me talk about Hokas and those max cushion shoes or high impact shoes, go back, read or take a listen to that information. But again, avoid those max cushion shoes because that is what's going to put a lot of increased impact through the lower extremities because we see increased leg stiffness in those runners. And then lastly, reducing the stress and load on the ankle. We know that moderate to high heel drop shoes are going to take pressure off the ankle and Achilles, and we're going to then put it on the knee and the hip. That can be helpful for these patients with an ankle sprain. The shoes we'd recommend here would be the New Balance 880s, Saucony Rides, Asics Gel Nimbuses are really good shoes. So you can recommend those to patients or you can check them out yourself as well to get a better idea. And then lastly, I just want to go through all the references here so that we have all the information of what we went over today. These are all the references. You're welcome to look at it. You're welcome to look at them and to be able to understand them a little bit better. Now, as we go through and talk about ankle sprains and the management and how we actually get an ankle sprain to return to running, this is one of those helpful tools that we can use to be able to help our patients. But obviously, there's not just ankle sprains out there. There's many other injuries out there. If you want to learn more about not only ankle sprains, but patellofemoral pain syndrome and hip impingement and greater trochanteric pain syndrome that all affect runners, check out our course, The Essentials of Running Gait Analysis, where you can learn not only how to confidently assess a runner's running gait, but you can also use that to create a plan of care for them so that they're getting better and so they're getting better outcomes. And it can help you build your business in terms of specializing with runners and being able to leverage running gait analysis for business growth. That's it for today. I look forward to talking to you next time. And if you have any questions, feel free to reach out. Until then, take care.